Hey everyone, it's Morgan here today at Dr. Stompro and Dr. Cheng's office. Today I'm here with one of Dr. Stompro's specific patients, Caitlin. Caitlin is 25 years old and she's 4 weeks out from having a Septo-Rhinoplasty. Caitlin, tell us a little bit about yourself and why you were looking to have this procedure done.
So a few years ago, I had broken my nose and I had started to become really insecure of how it had healed.
Okay. Following any nasal injury, sometimes the nose can be left a little deformed, slightly crooked, the tip a little larger than natural, and sometimes even some breathing issues. Caitlin specifically had a septo-rhinoplasty because following the injury, she also had some breathing issues. So you kind of got 2 for 1, right? You got the breathing corrected and you got the cosmetic change to it.
Yeah.
How did you find Dr. Stompro?
I had a family friend of my mom's recommend this place.
Okay, good. Yeah, a lot of our patients are word of mouth, considering the fact that Dr. Stompro has been in the area for so long, and he's great, very gentle. That then leads me into, how was your recovery for that first week?
It was honestly very easy. I would say just the first day was a lot of rest, but otherwise it was smooth recovery.
Oh, good.
Yeah.
And you were kind of anticipating a longer recovery.
Yeah.
So how many days were you on pain medication?
Honestly, I only took Tylenol for a few days and then I was fine.
Oh, that's amazing. And then tell everyone, when did you really feel like you could go back in public, either return to school or return to work, based on your bruising and swelling?
Yeah, so if you work from home, you could honestly go back a few days after. But I was able to start working the week after with just my camera off, and then after a few days, once I got my cast off, I was back just fine.
Good. And when the cast comes off, that's normally a week later. So even at 1 week, she felt comfortable enough to go into public. What we're going to do now is we're going to show her before photos so you can kind of see the things that made Caitlin insecure and what we wanted to correct. So longer, so we wanted to shorten the length. When you look at her profile, there was a curvature to the bridge. And when you look at the front view, the tip a little too square. So we wanted to bring things a little bit more narrow, make the bridge straighter, and make the nose appear a little bit shorter. Go ahead and turn your head just a little bit to the left. So as you can see now at 4 weeks out, the bridge is straight. There's no more curvature. The nose does not appear as long. It's been shortened. And if you look at her from the front view, the tip is no longer square and it's been brought in to appear more narrow. Thank you so much, Caitlin, for telling your story. It really just goes to show that everything that you read online, it's a lot less different, and recovery is easier, not a lot of pain involved, and looking great at 2 to 3 weeks post-op.
Yeah.
Thank you.
Yeah, of course.
Thank